I will be going to demonstrate on how to insert the nasogastric tube. So the purpose of this is to administer tube feedings and medications to client unable to eat by mouth or swallow sufficient diet without aspirating food or fluids into the lungs, and also to establish a means for suctioning stomach contents to prevent gastric distension, nausea, and vomiting, and also to remove stomach contents for laboratory analysis, to lavage the stomach in case of poisoning or overdose of medications. So in preparation for inserting a nasogastric tube, so you need to prepare or you need to assess for history of nasal surgery or deviated septum of the patient, so the patency of the nares, the presence of gag reflex, the mental status or ability to cooperate with the procedure. And then you should also determine the size of the tube to be inserted, so whether the tube is to be attached to the suction or not. And then next is you should assemble all the equipments and supplies. So you will be going to need the nasogastric tube, a large or small bore tube, and then the hypoallergenic adhesive tape. So adhesive tape, the clean gloves, water soluble lubricant, so the water soluble lubricant, then facial tissue, so facial tissues, and then glass of water and drinking straw, and then 20 to 50 ml syringe with an adapter, so or the accepto syringe, so the basin here. And then page test strip or meter and bilirubin dipstick if available. And then the stethoscope. And then suction apparatus if required. And then safety pin and elastic band. Or you can use also the adhesive tape. And then next is assist the patient or the client to a high colors position if health condition permits, and supports head on a pillow. And then place a towel or disposable pad across the client's chest. So the next procedure will be you should introduce yourself to the client and verify the client's identity, explain to the client what you're going to do, why is it necessary, and how the client can cooperate. So some of your patients when inserting an NGT are those patients which are stroke. So you can introduce yourself to the significant others or the relatives of the patient, and you can verify the client's identity and explain to them what you're going to do. And then next is perform hand hygiene and observe other appropriate infection control procedure, and then provide for client privacy. So first you should assist the client to a high Fowler's position. So yeah. So after assisting the client to a high Fowler's position, so you will now assess the client's nair. So ask the client to hyperextend his or her head, and using a flashlight, observe the intactness of the tissue of the nostrils, including any irritation or abrasions. So sir, can you please take off your mask? And then examine the nares for any obstructions or deformities by asking the client to breathe through one nostril while occluding the other. So then, and then select the nostril that has the greater airflow. So so prepare the tube. If a small bore tube is being used, so ensure the stylet or guide wire is secured in position. And then first you should put on your gloves. So considering these are your sterile field, so you should put on the tube on your tray without touching it. So this is considered as sterile. And then put on your gloves. using a sterile technique. Next is determine how far to insert the tube. So use the tube to mark off the distance from the tip of the client's nose to the tip of the earlobe, and then from the tip of the earlobe to the tip of the xiphoid process. So get the tube and then determine how far you will now insert the tube. So in determining how far you will insert the tube, so make sure that it doesn't touch the patient's body. So from the tip of the nose to the tip of the earlobe down to the xiphoid process. So this is how far we should insert the tube, and then mark this length with adhesive tape if the tube does not have markings. The next. And then in inserting the tube, so you should put on your gloves and then lubricate the tip of the tube well with water-soluble lubricant or water to ease insertion. So you can ask someone to put on the lubricating jelly onto your hand or onto the sterile field. So, then make sure that the lubricating jelly does not touch your sterile gloves. Okay. So after that, lubricate the tip of the tube well with water-soluble lubricant or water to ease the insertion. And then insert the tube with its natural curve towards the client into the selected nostril. And ask the client to hyperextend the neck and gently advance the tube towards the nasopharynx. And then direct the tube along the floor of the nostril and toward the ear on that side. So, sir, mag-insert na po tayo. So, assuming that you will now be going to insert the tube, so you will now ask the client to hyperextend the neck and then insert and then sige, next. And then slight pressure is sometimes required to pass the tube into the nasopharynx, and some clients I may water at this point. And then if the tube meets resistance, withdraw it, lubricate it, and reinsert it into the other nostril. So insert the tube. So once the tube reaches the oropharynx, the client will feel the tube is in the trough and may gag and retch. So ask the client to tilt head forward. Tilt head forward and encourage the client to drink and swallow. So ask the client to drink and swallow. Okay. And then, if the client gags, stop the passing of the tube momentarily. So have the client rest, take a few breaths, and take sips of water to calm the gag reflex. And then, in cooperation with the client, pass the tube 5 to 10 centimeters with each swallow until the indicated length. So, until the indicated length or the marks. And then if the client continues to gag and the tube does not advance with each swallow, withdraw it slightly and inspect the throat by looking through the mouth. And then in ascertaining the correct placement of the tube, Aspirate stomach contents and check the pH. Dito ka nga ba maghanap ko? So suppose you have inserted the tube. So you will now going to ascertain the correct placement of the tube. So you will now be going to aspirate stomach contents and check the pH or the bilirubin. So if after checking it, so another way of ascertaining the correct position or placement of the tube is also an X-ray as per agency policy. So if a small bore tube is used, leave the stylet or guide wire in place until the correct position is verified by X-ray. So um, another way on how you will going to ascertain the correct placement of the tube is placing a stethoscope over the client's epigastrium and inject 10 to 30 ml of air into the tube while listening to the whooshing sound. So make sure that your tube is clamped or closed. So you will now be going to use the asepto syringe and the stethoscope. So using a stethoscope, you can also determine or ascertain the placement of the tube. So place the diaphragm of the stethoscope over the epigastrium of the patient, and then instill 10 to 30 ml of air into the tube while listening to the whooshing sound. So assuming that you have hear the whooshing sound, remove the stethoscope, and then remove the acetylsyringe syringe, and then secure the tubing, and then secure the tube by taping it to the bridge of the client's nose. So like that. So assuming that you have secured the tube by taping it into the bridge of the nose, you'll now be going to attach the tube to a suction source or feeding apparatus as ordered, or clamp the end of the tubing and then secure the tube to the client's gown. So you can use an elastic band or a pin, safety pin, or you can use the adhesive tape. So like that. And then document relevant information, document the insertion of the tube, the means by which correct placement was determined, and the client response. And then establish a plan for providing daily nasogastric tube care. So you will be going to inspecting daily the nostrils for any discharge and irritation, and clean the nostril and tube with moistened cotton tip applicators. And then apply water soluble lubricants to the nostril if it appears dry or encrusted. And then change the adhesive tape if required. If hindi na siya masyadong nakadikit, you can change it. And then give frequent mouth care. And then if suction is applied, ensure that the patency of both the nasogastric tube and suction tube is maintained. That's the procedure and how to insert the nasogastric tube. So let's come now to administering a tube feeding. So first, you should assess for any clinical signs of malnutrition or dehydration, for allergies to any foods in the feeding, and for the presence of bowel sounds, for any problems that suggest lack of tolerance of previous feeding. And then determine the type, amount, and frequency of feedings, the tolerance of previous feedings, and then assemble all the equipments and supplies, the correct amount of feeding solution. So assuming this is a feeding solution, and then 60 ml catheter tip syringe, so that or the asepto syringe, the Mazis basin, and then clean gloves, and then large syringe or calibrated plastic feeding bag with label and tubing, the measuring container from which to pour the feeding, and then water at room temperature and feeding pump as required, and then also the stethoscope. So assist the client in a hypolars position. And then, so next is introduce yourself to the client and verify the client's identity. Explain to the client what you're going to do, why is it necessary, and how the client can cooperate. And then perform hand hygiene and observe other appropriate infection control procedure. So perform hand hygiene. And then provide for client privacy. The next is assess the tube placement. So attach the syringe to the open end of the tube and aspirate or check the pH. So attach the syringe to the open end of the tube and aspirate, then check the pH. So in aspirating, you should deflate the bulb, and then so you should check the pH of this. If it is 0 to 5, the result is on the gastric contents. So meaning the placement of the tube is good or in the proper placement. And then, or you can also check by using the stethoscope. So attach the asepto syringe to the tube and then place the diaphragm of the stethoscope onto the epigastrium of the patient, and then release the clamp, and then instill air into the tube. And then once you have heard the whooshing sound, so meaning the position of the tube is correct. So assuming that you have checked all the necessary placement of the tube, and then let's proceed to the feeding. So in administering the feeding, you should check the expiration date of the feeding and warm the feeding to a room temperature. So when an open system is used, clean the top of the feeding container with alcohol before opening it. And then let's administer now the feeding. So you should always clamp the tube and then remove the accepto bulb, and then assuming this is the feeding solution, so you will put the feeding solution into the syringe, but by using the gravity. So make sure that may titira kang water dito sa syringe. Okay? So that air will not be going to instill into the client's stomach. And then you should And then when flushing the feeding solution, you can add water on it before all the feeding solution are gone. So like that. And then make sure that there's no feeding solution onto the tube. Okay? And then clamp the tube and remove the syringe. And then clamp the feeding tube before all the water is instilled. So ensure the client's comfort and safety. Secure the tubing to the client's gown again. And then ask the client to remain in a sitting upright or in a Fowler's position or in a slightly elevated right lateral position for at least 30 minutes. And then check the agency's policy on the frequency of changing the nasogastric tube and use of smaller lumen tubes. And then dispose of equipment appropriately. So if the equipment is to be reused, wash it thoroughly with the soap and water. So this syringe can be washed off and can be used onto the next feeding. So change the equipment every 24 hours or according to agency policy. And then document all the necessary information or the relevant information, the document the feeding, including the amount and kind of solution, and record the volume of the feeding and water administered on the client's intake and output record. So that's how you will feed the patient via nasogastric tube. So let's come now to removing a nasogastric tube. So first, in the preparation, assess the presence of bowel sound for the absence of nausea and vomiting when the tube is clamped. And then, assemble the equipments and supplies, the disposable pad or the towels or the tissues. And then the clean gloves, and then the septum syringe, and this is optional, and then the plastic trash bag. And then confirm the primary care provider's order to remove the tube. So you should check the doctor's order for removal of the tube. And assist the client the sitting position if health permits, and then place the disposable pad or towel across the client's chest. So assuming that the client has now the disposable pad or towels across his chest. And then provide tissue to the client to wipe nose and mouth after tube removal. And then introduce yourself and verify the client's identity. So explain to the client what you're going to do, why is it necessary, and how the client can cooperate. And then perform hand hygiene and observe other appropriate infection control procedure and provide for client's privacy. So let's go to the detaching the tube. So first, disconnect the nasogastric tube from the suction if present, and then unpin the tube from the client's gown. And then remove the adhesive tape securing the tube to the nose. So assuming that you have detached or removed the adhesive tape from the nose, then remove the nasogastric tube, put on your gloves, and then ask the client to have a or take a deep breath and to hold it. Then pinch the tube with the gloved hand and smoothly withdraw the tube. So ask the client to take a deep breath. So deep breath and hold it. So smoothly withdraw the tube. And then place the tube in a plastic bag and observe the intactness of the tube. So you can use your gloves to secure the soiled NGT. And then ensure client comfort, provide mouth care, and ask the client to blow his or her nose. Because some of the, yeah. And then dispose all the equipments appropriately. So place the pad or bag with tube and gloves in a receptacle designated by the agency. And then document all the relevant information, record the removal of the tube and the amount and the presence of any drainage.